Welcome to the seminar, which is organized by the Collective for Political Determinants of Health. In our new webinar series, we're going to aim to bring the Collective's member scholarship to a broader audience. And we are starting today with Alicia Yamin. But before we start, I will introduce myself. My name is Katerini Storeng. And for those of you who are not part of the Collective, I co-directed with Sakiko Fukuda-Par. And the Collective is dedicated to advancing research on how power constellations and institutions and interests, ideological positions affect health within different political systems and culture, and also at different levels of governance. And I'm very pleased today to be inviting our member Alicia Yamin to give this seminar. She currently teaches law and public health at Harvard University and has at least 3 decades of experience in human rights and practice, living and working with advocacy organizations across the globe, and has also been prominent in Partners in Health. And today she's going to speak about her book, which has recently been published in a revised and expanded 2nd edition. And it surveys the progress and challenges in deploying human rights to advance health and social equality over the past few decades. I'm not going to say much more about the book. We're going to have a presentation from Alicia first, and then we will open it up to Q&A, and we hope that we will have a good discussion. We will be finishing at 1600 hours Central European time, so in 50 minutes from now. But before we start, I just wanted to say, just to quote our colleague and Collective member, Shea Abimbola, who says about this book that it makes you believe in the power of invoking human rights to advance health justice, especially if you're doubtful, despondent, or simply new to the topic. And so, as he says, this book is filled with stories that ignite a fire in us to do something and insights to think through what you might do. And so we're very much looking forward to hearing from Alicia about this book and to have a discussion with the audience afterwards. Thank you very much.
Thank you so much, Katerini. It's really such a joy to be able to have this conversation with this group in particular, because I've been so inspired over the years by reading many of you and listening to many of you. And of course, Sakiko wrote a really very generous and brilliant foreword to this edition. I think I have managed to figure out how to share the screen. Let me know if this works. Does it work?
Yes.
Great.
Thank you.
So yeah, I think this will be easier. So I started to write this book. Actually, this is the 2nd edition, as you mentioned. And I started to write the 1st edition in about 2017. And I want to take us back to 2017. When already, that was after the Paris Accords, when the IPCC was saying that 1.5 degrees over pre-industrial levels was going to be very challenging. The climate crisis was evident in many places around the globe. There were gaping social inequalities. It was, this was the time when Oxfam was already starting to issue those annual reports on inequality around the world. And we were seeing really before our eyes the effects of decades of neoliberalism, underfunded and privatized health systems, but also other systems, education systems, social protection, for example, crumbling infrastructure. And there was a crisis of liberal democracy. This was the time Trump had been elected in 2016. There had been Brexit. There had been a defeated peace accord in Colombia in 2016. So this sense that the democratic institutions that we thought could deliver socioeconomic rights was beginning to crumble. And that gave rise to this wave of kind of conservative nationalist populism. And I think there was also a growing sentiment that the multilateral order was not fit for purpose. The order that had been constructed after World War II, based on this kind of negotiated agreement of United Nations being somewhat more democratic versus the Bretton Woods institutions, had really morphed over these years and was not meeting its needs. It wasn't ensuring adequate debt restructuring and reduction and cancellation. There were gaping health and social inequalities. and a huge protest against some of the global institutions that we saw. So that's the context that I wrote the book in. And I should also add that when I started to write the book, I was also concerned that human rights seemed quite divorced from these questions that seemed so pressing to me. Not all of human rights. I go to great lengths in the book to say that human rights is a very diverse tapestry of different organizations and groups around the world. But a subset of human rights that is from the global north, that has gotten a lot of attention, had kind of decided that, okay, we've achieved so much in social and economic rights, and now we just need to implement it. And that can be done through global health governance. And that kind of sort of top-down mainstreaming seemed absolutely wrong to me to challenge power asymmetries. So in a way, the book is a kind of critical genealogy of human rights and an answer to that position among a significant group of human rights scholars, especially in the global north and probably particularly in the United States and Great Britain. So what it talks about, and it's a temporal sequence from really from the 1970s, but I go back to the creation of the Universal Declaration to, in the Nietzschean sense, so how did we get to where we are now, right? To understand that initially, to see where we might go from here in a more transformative way. Then it synthesizes across multiple fields. It doesn't do a very deep dive into the legal intricacies of human rights law, and certainly not economic development or public health, but it connects the dots because I believe when I wrote the book, and I continue to believe that some of the most challenging parts of telling this narrative and also of figuring out what to do is this siloization of knowledge into specific fields that kind of blind us to the need to move and work across fields to create real change. And the third thing, just to give you a flavor of the book, is it is, as Katerina mentioned, a combination of firsthand experience with lots of personal stories, which I feel, has a great feminist tradition, and there are lots of traditions that use narrative, but principally it's because these are quite complex and arid issues, and people care about human rights because of the human stories that they can relate to, that they can apply in their own lives. So I have found it to be a wonderful teaching tool with students, and for them to be able to take hold of the concepts, not as general comments, this says X, Y, Z, or the Committee on Economic and Social Rights says so and so, but really on what it means, these different rights mean in specific concrete contexts. So that personal narrative is woven together with theoretical discussions. And just to give you an example of what that looks like, this is the beginning of one chapter. As images of bodies lining the Ganges, mass graves in Brazilian favelas, and makeshift morgues in New York flowed across our large and small screens during the first years of the pandemic, along with a daily saturation of numbing statistics, even those not visited directly by the Grim Reaper were forced to contemplate whose deaths are grieved and why. Grief and mourning are not the same. We mourn many public figures whose obituaries elide episodes of their fecklessness. We take note, if not mourn, the passing of the masters of the universe who tried to defy the myth of Icarus. We mourn the soldiers, often in the prime of their lives, who made the ultimate sacrifice for their country. Grief, as opposed to mourning, is a private affair, reserved to those for whom the absence of a person leaves their inner worlds shattered. Sometimes, however, in the very saddest of cases, neither grief nor mourning are to be found in the shadow of loss cast by a death. Blame, shame, and recriminations, or merely indifference, fill the space that a human being used to inhabit. The death of Paula Arisanka Barrientos, when she died in childbirth in the early 2000s, was one of those cases. And then I use her story. Paula died in this putuco on the Peruvian Altiplano, where her mother had died in childbirth. And this is her common law partner here at her grave and the grave of the child who died. So I use the story to then weave out some of the theory about what was going on in Peru at the time, which was under Fujimori, and there was a real shock doctrine and neoliberalism, and the role of the health system in all of that. And that's how every chapter sort of evolves from a personal story to looking out at how to situate that story in a broader framework. So I'm just going to briefly go through the main arguments of the book. The first one is really about whether human rights has been effective. And I say that starting out, and by starting out, I mean when I was a law student in the late 1980s and early 1990s, we recognize that in order for socioeconomic rights to have the same kind of capacity to dilute economic power the way civil and political rights had fostered more democratic norms, we needed to, one, and subvert entrenched ideas that health and other socioeconomic rights were not real justiciable rights, but merely programmatic aspirations. Second, we needed to, and there I think we have made significant progress. The right to health is legally, judicially enforced around the world today, even in many poor income countries like Uganda. And the questions are now different. The questions are about how enforcing the right to health can catalyze more equitable health systems broadly. The second challenge was articulating what it means to take health rights seriously in laws, policies, practices, and really institutionalize them. And there again, I think we've made significant progress on looking at criteria, on focusing on multi-sectoral planning, on making sure that inequalities, disparities are considered from the outset, not as an afterthought, on looking at social determinants of health as opposed to just medical care. But I also think the goalposts have shifted in terms of not wanting just a formula that's pronounced by some treaty monitoring body and really making it something that is a process that challenges the powers that be in governance of health. The third challenge, demonstrating that using rights to advance population health could achieve meaningful progress towards social justice in national and global orders, I think is where we have fallen short. And that's where I am most critical. And I don't think this is in any way a spoiler to say, because I discuss this throughout the book, to say that, you know, from the 1970s on, inequality has exponentially increased around the world, in countries around the world, to lesser and greater extents, but exponentially. And the second thing is, in this graph, it is private wealth that has most dramatically expanded, right? Private wealth has really greatly expanded, while public wealth and public capital has actually declined somewhat. And the argument I make is that it's actually public capital and public wealth that is necessary for delivering on health and other socioeconomic rights. Private wealth can redound to the benefit of very wealthy people, individuals. But this split between private wealth and public wealth that has everything to do with neoliberalism, but also financialization from 2000 on, has deformed political processes. And also, the argument I make is that it's actually captured our collective imagination. So that now, if you teach, I'm sure you see this with students sometimes, the idea that there is something else, a different way of doing things seems almost unimaginable. Of course, the private sector is more nimble than the states. Of course, we should make things more efficient by privatizing. And that's, I think, something that we need to challenge, that narrative, as well as the actual control of private capital. And I'll talk about that more. Now, if you look at it globally, the allocation of monies, because it is not, and I'm sure with this group I don't have to say this, it's not that there's not enough money in the world, right? Money, the global economy has doubled since the turn of the century, the turn of the millennium. It's quintupled for over the last 4 decades, but it's how it's allocated. And if you look globally, in addition to private actors having more money, the drains, and this is from Jason Hickel's work, from the south to the north have been just a massive suck of resources from the south to the north, even as we constantly talk about aid from the north to the south. This drain actually vastly exceeds that amount in aid. And there are lots of reasons for this. There's obviously debt. There is transfer pricing and illicit financial transfers. There's and some of tax evasion is actually legal today. And there's intellectual property, which is a huge suck from the south to the north, and unequal terms of exchange in general. So that's one of the major reasons why socioeconomic rights in the South, there's just not enough resources and capacity to deliver on robust universal health systems, for example. So a second argument I make in the book is about how human rights function, which is subject to debate and is actually quite contested. There are scholars who, again, view this as something that happens from the top down, that is reasonably disconnected from social justice movements that are working on the ground to advance some of the same things, but overlapping. And then there's another view, which is my view, that it's a much messier, more dynamic and recursive process where these broad but universal values are activated and given meaning through this ongoing mobilization of affected people. And that includes courts, it includes activists, it includes international institutions, but it is not a separate top-down through global governance, which I believe is permeated by power relations, and a bottom-up social mobilization from social justice people. And this is one of the cases in the book diagram to show the kinds of different actors and mobilizations that I describe. So how human rights works obviously affects what are the impacts that we measure in terms of whether it's been effective. So one of the stories that I tell is about Argentina and abortion rights. And here, if you just look at the pictures, you can see the woman, the grandmother with the white kerchief against the wall of people who were disappeared during the civic military dictatorship. And those white kerchiefs came to symbolize, as the mothers and the grandmothers marched around the Plaza de Mayo, democracy, hope for democracy during the dictatorship, right? But the green kerchiefs later, as Argentina returned to civilian rule in 1983, the green kerchiefs, the purple kerchiefs against gender-based violence and femicide came to take up that symbolism and represent, well, you cannot have a meaningful democracy if you have two kinds of justice systems, one justice system for, say, a murder that's committed in the street, and another justice system for a woman who's killed by her boyfriend or husband within the home. That's ni una menos, not one fewer. And you can't have a meaningful democracy if half of humanity's life and death health issues are not treated in the health system, which is a core social institution. And that's the green kerchief of the Green Wave movement. And so that symbolism, that appropriation of subjectivity and dignity runs throughout the book and is something that I take very seriously, not just improvements in material conditions. So now, as many of you may know, Argentina elected an anarcho-capitalist president last December, who has imposed very, very draconian, extreme austerity measures. And I was recently there, and this was somebody at the end of the block talking about Milei being individualistic and cruel, et cetera. And it is the politics, necropolitics, I would say. But the kerchiefs have now become a symbol of resistance in many, many ways. So both in terms of what gets achieved, but also in terms of resistance, the impact, the importance of human rights surpasses just one legislative victory or one financing gain, for example. The book talks a lot about health systems, obviously about the right to health and health systems. This is the famous WHO, UHC cube, where you move along these axes. And from a human rights point of view, a health system both reflects and communicates values in the overall society. It exacerbates exclusion and marginalization in many cases, just as criminal justice systems do in many cases. But it also can enhance inclusion. And this is true from macro levels of financing to the way services are organized in countries where sometimes in remote rural areas, there is very little access to healthcare or anything more than primary care. How priorities are set, whether that's done behind closed doors by so-called experts or whether there is citizen participation. Obviously, the way patients are treated, but also the way health workers are treated, whether they're on service contracts and can easily be dismissed, et cetera. And human rights also puts a great deal of value in the background conditions, right? That these decisions are not happening in a vacuum. But for example, in a country like Kenya, which is overwhelmingly dominated by people working in the informal sector, how is health insurance, is access to care going to be guaranteed by a social insurance program where actually when people pay their premiums, even when people pay their premiums, they're often not given the care because of stockouts, because of a variety of different issues. So human rights pays a lot of attention to those background subordination issues. The book also talks about global health justice because many of the sort of rules or criteria that we would use within a single polity of political and moral equality to measure unfair health inequalities don't necessarily apply at a global level. So I talk about various approaches to global health justice, including international assistance and cooperation. I think at the beginning, I already made clear that aid is dwarfed by other factors that suck resources out of the global South. I think aid needs to be massively scaled up and massively democratized so that so-called beneficiary countries also have a seat at the table, as do members of civil society, because I think our aid model is grossly obsolete and inequitable and crisis-driven. Happy to talk about that in the Q&A. Then how do we fix international norms and practices and multilateral governance? And this has to do with those illicit financial transfers, with debt. Governments in the global South, low middle income countries often pay more in just external debt servicing than they do spend on health, or sometimes health and education combined. So the idea that in the SDGs we're going to leave no one behind is rather a hollow promise under those circumstances. Illicit financial transfers, this chart is somewhat informal, pulled together from data from Partners in Health, where we work in all of these countries, where the amount of spending on health is absolutely minuscule by comparison with what is lost to these countries in illicit financial transfers and tax evasion. Then I believe, and I argue in the book, that it's insufficient to look, precisely because I take a temporal view toward what justice is, that we need to look back and look at reparative justice. And, climate financing is probably the most obvious arena to do this in, of loss and damage. But there are many, many others, and I have colleagues who are on different reparations commissions. And finally, and this is something that Shay talks about, epistemic justice. I usually refer to democratization of knowledge and authority because I feel, as a white person who has family in Argentina as well as the United States, but nonetheless from two settler colonialist countries with enormous layers of privilege, that I'm not the one to speak about decolonization, although I support many of those efforts. But we certainly need to democratize knowledge and knowledge production in global health, and not to just put tokenistic authors on Global North articles or in Global North institutions or consortia. Because that, in effect, reifies the unfair knowledge practices that Shay and others have spoken about so eloquently. So this is all a little bit grim. The book is not grim. The book is in many ways hopeful. A lot of the things that we thought were absolutely impossible that have happened over these years happened, right? That slowly, iteratively, with ant-like advocacy work, nobody ever would have believed that HIV medicines were going to be made widely available in South Africa at the time. I remember those cases. I did an amicus brief in some of those cases. Nobody ever would have believed that abortion was going to be legal in Argentina and maternal infant care was also going to be free for the first years of life in a highly Catholic country. And it happened. And it happened during the pandemic. Nobody would believe that in Uganda, maternal health care would be free of charge and that civil society would be monitoring budget allocations all the country, but it happened. Nobody would have believed that obstetric violence, which is so unbelievably normalized throughout the world and possibly particularly in Latin America, would come to become a legal figure and that people would mobilize against it. There would be judgments against it, but it happened. Nobody believed that courts would issue orders that required governments to change their carbon and pollution policies because it affected other countries, not just people within their borders. But it happened. And today, you know, we have very promising movement on a UN tax convention, having taken that power away from the club of donors. Just the idea that there is one tax rate that transnational corporations have to pay no matter where they're headquartered, where they operate, is an incredibly powerful way to shift power from those private actors. Debt restructuring, Partners in Health, along with Oxfam and others, have been involved with trying to change the rules of the game in New York State. And there's a similar effort in London where all of these debts are restructured to give sovereign governments more power in the process, in these processes that are grossly unfair, very drawn out, and impose penalties on the sovereign of many different kinds because of loss of liquidity, surcharges, on and on. Investor state dispute resolution used to be taken for granted, but now people are questioning it. Even Catherine Tai, the US trade representative, is questioning it. So whether, because these investor state dispute resolutions, if there's a Mexico-Canada free trade agreement and there's something that an investor wants to do that's going to cause enormous toxic waste in some community in Mexico, they have to go to one of these mechanisms instead of having the power, the sovereign power and capacity to determine whether that's something they want on their land. And then, of course, climate activism and links is inspiring if it's going to face very significant obstacles, especially given the last EU elections. So I will stop there, and I'm really looking forward to questions.
Thank you so much, Alicia.